Hello, everyone. Welcome back. Welcome back to the CAT Scan Guru podcast. How is everybody doing? We are preparing for this massive heat wave that is going through the state of Illinois, which freaking sucks. So I am not a happy camper about any of that. So, yeah. Kind of gearing up for what is to come when it comes to that. So, little housekeeping. I have noticed that I have gotten an amazing increase following on Instagram. I know it's been several months since I've posted anything on Instagram, and I think it's just amazing. So, one of my videos is like blowing up over there. So, I will be consistently posting on Instagram, making sure that I post on all my social channels. I've also started a Facebook page again. I had a Facebook page probably back in 2023, but because I was really taking off on TikTok and semi kind of growing my Instagram channel and doing things with the YouTube channel. I kind of ceased doing that because that was one of the very first Facebook pages I had, and it was terrible. I wasn't a really good content creator then. But as time goes on and you flex that muscle in more repetition and you learn things, you just become better at it. Okay. It's the same way in CT. And same way, when you go through the X-ray program, you just learn how to do things better, right? So I have started a Facebook page. I will link it in the show notes. It's called the CAT Scan Guru, same name as all of my other handles, and go check that out and go give it a follow. So I have started putting a lot of the videos that I have repurposed from TikTok and Instagram and, video clips of this podcast. So with the really good talking points as far as that. So make sure you guys go follow the Facebook page. And yeah, so we're just, going all across platforms. So I have rejoined Facebook page but it's of course going in the same direction as my Instagram, YouTube, and the TikTok channel. So go give it a follow. Also, make sure you share this podcast, follow the show, subscribe so that you can get the latest and greatest on all your CT needs, skills, and education. So let's get into today's episode. So in today's episode, I'm going to be discussing the CT skills that needs to be taught. These are skills that every CT technologist, when you're brand new or even seasoned, needs. Okay. So I have been getting a lot of DMs and questions and things like that on my TikTok page and in the DMs. So I have a couple people that I am trying to help via the DMs as far as their CT training. One got like 8 weeks of training. The other one got 10 weeks of training. And both of these technologists are very overwhelmed and they are having a tough time when one of them wants to throw in the towel and quit, which I don't think she should quit. And I have tried to coach her and tried to tell her, hey, let's just take it step by step. Here's some things that might help and let's get you in the right direction. And you cannot stress over things you can't control. Okay. Because CT is very complex. It's a very high face, high demanding modality, and sometimes it's not for everyone, to be quite honest, right? So, the one thing that I look at when I see CT as a whole, we focus a lot on tasks and what we should be doing and the things it should be doing instead of really focusing on the why and the learning aspect of it. Now, I know what you're going to tell me, Karinna. Well, we are short staffed. We don't have enough people to train. The ER list is so freaking busy. And I understand all that. Okay. But in order to make techs successful and make sure that they can operate on their own on that floor, we have to do our due diligence in making sure that we set up a properly structured training program in our departments to make sure that they get the best tools, the best skills, and the best educational needs as possible. Okay. So a lot of the things that techs do struggle with is workflow. So very simple is, okay, I have the CT of the head. What protocol am I supposed to select? What should I do as far as putting the patient on the table, centering purposes, the laser light, all those things that I see when I am training somebody new that they do struggle with is, the workflow aspect because it's A through Z. We have to check labs. We have to check pregnancy on female patients. We have to check to see if they've had any prior imaging, any allergies, contrast reactions. So it's a lot of things that we have to look at before we even scan the patient or even talk to the patient about the exam. And then there's a lot of decision making. Okay, well, this patient states that they had itchiness when they had contrast last. What do we do about this? Do we get pre-medication? Do we get, bring the patient back, maybe a without study if it's appropriate, or a different alternative test if that's the case? There's a lot of decision making. IVs are bad. The exam is not ordered correctly. We need additional orders to get whatever it is that they're trying to rule out. So it is very complex, and there's a lot of decision making that we have to do as far as the job aspect. And then, of course, protocols. Protocols are the biggest one because there are a lot of protocols that we see. And I'll tell you, our little brains cannot remember all those protocols because it's just impossible. So, protocols. What I like to do is I like to start out with just the core basics of exams and protocols. So, that is going to be your heads without. That's going to be your PE studies. It's going to be your common stroke protocol with the perfusion, CTA head and neck. It is going to be your abdomen and pelvis with contrast just routinely. It's probably going to be a CTA abdomen and pelvis if they're looking for AAA, your CTA chest abdomen pelvis if they're looking for dissection. Whatever the case may be, C-spine without, facial bones without. Those are your common exams that we should be teaching and making sure that they hardwire and they repeat and they go ahead and perfect those exams. Well, perfectionism, not really perfect, but make sure they understand and they can execute those exams flawlessly. Okay. So that is one of the things that I like to teach everybody that's brand new is make sure that you know your core basic exams, proper exam execution. And I'm going to talk about this again, guys. I know you guys are tired of hearing me every single podcast episode, patient centering. It is very important that we show our new technologist patient centering. Okay. So patient centering is very, very important because it is going to affect, and it's a major factor when it comes to your radiation dose. Okay. Patient centering is a big thing. Using the laser light correctly. Those are the things that need to be hardwired because those are the things that are important. And making sure that your patient is centered correctly on the table, making sure that proper centering is, done, and making sure they know that, your crosshair is at the Z axis. Okay. Because that is where we center is at the Z axis. Okay. So making sure that we do proper exam execution, giving the patient, instructions during the exam, explaining the exam to the patient if they're alert and oriented and can understand and repeat back to you what you're saying. And if they have any questions, you can answer that. Okay. Explaining contrast, side effects of contrast. Every patient's going to feel they're going to pee themselves. Every patient's going to get hot. Some people get metallic taste. Some, it irritates the lining of their stomach and they don't feel well. Okay. So proper instructions, breathing instructions, any after exam instructions are all part of that proper exam execution. Okay. So those are kind of some of the things that I think as far as skills that need to be taught. Now, we also need to explain the why behind the exams. Why we time our PE studies the way we do, why we time our abdomen and pelvises routinely the way we do. Okay. So why we execute a trauma scan the way we do and why we retro recon things, so we don't have to re-radiate the patient and we can just recon the spine off of a chest abdomen pelvis. So when we take the time to explain the why to our brand new technologists coming in, and it's the future of this modality, we have to make sure that we explain it so they understand and there's good communication and understanding from it. Okay. So making sure that our technologists know their basic core exams, making sure that they execute those exams correctly with proper centering and proper laser light placement. Okay. Making sure that they understand protocols, they understand the workflow and they do good decision making. Okay. So we can prevent mistakes and any sentinel events, because the last thing you want is to have a sentinel event and say, oh, well, I wasn't taught that. Okay. So, and then answering their questions. As a new technologist, what I would advise you to do is make sure you have a notebook so you can write things down. I say this in every podcast episode. Make sure you have a notebook that you write things down because that is essential and it's important because you never know when you need to refer back to it. And then, look at your protocol books. making sure that you know how to execute the exams as well. There are many times that, especially if I haven't done a 3-phase pancreas, I sometimes forget all the phases and I go, okay, let me go look in the protocol book just to make sure I have all the phases correctly. Enterography studies, we do see them, but sometimes it could be a while before we see one, and just making sure that I know exactly what we need to do as far as that. So, all these tips to give the skills that these new technologists need is super important. Okay. Now, these two technologists that I'm trying to help in the DMs, it is very overwhelming because they feel like they got thrown into CT, which is a very common tale that, they basically shadowed exams and then they were told how to do the exams. But then after 10 weeks, it's like, okay, here you go. You can operate on your own. Not everybody catches on quick, you guys. Not everybody does. Okay. Sometimes people need more time. And it's up to us to make sure that if they ask for more time, we give them more time. One of the techs in my department had asked for more time when she started out, what was it, several years ago? So she asked for more time because she wanted to make sure that she can operate on her own and that she was able to execute and do these exams properly. So we cannot shame people because they need more time. Some people's learning curves are a little bit slower than others, and we have to be mindful to give them that extra time so they can go ahead and learn and execute these exams properly. So that is it for today's episode. Hope this was insightful as far as the different topics and the different techniques to make sure you have the skills that need to be taught as a new CT technologist. Also, make sure you guys follow on all the social channels. Everything will be in the show notes. Subscribe to the YouTube channel. Send this to a technologist that needs to hear it, and make sure you subscribe to the show. I'm always grateful that you guys continue to listen. So thank you for joining me in this episode, and I will chat with you guys in the next episode.